Hello and welcome to the R4RA test database training. So here is the login page. When you are first invited to join the database, you will receive an email to the address that you've given us, and it will give you a token in which you can log on and also a one-time only web address. Please note that this web address cannot be used later on. As such, once you are fully in the database and signed in, please bookmark the web address that you are led to. Please note that for this training, this is not the correct web address. This is our test site, which can be used for training purposes. When you first log in, you will be asked to put in your login details, which will be your email address, and to create a password. When you click Submit, you will go through to the main site. For the future, however, once you've submitted your login address and your password, you will be asked for a token. This can either be sent to you via email or via text message if you've also provided your mobile number. Once you have submitted, whichever format you've asked it to be sent to you, you will receive. I've put it through an email, and this is what it will look like. You will receive a 4-digit token, which will be valid for 8 hours only. So you then need to take this 4-digit code, add it in here, and then retype the password that you set. So here is the main R4RA homepage. There are a number of different functions here, some that you may not see. It will depend entirely on which user permission you are given upon setup. So you will not see these 2 green buttons, and you will not see these 2 orange buttons. However, you will see these 2 blue buttons at the top, which I will get to shortly. Here we have the search function, where you can search via study number or temporary ID, and it will appear on the side here if you're looking for someone specific. You also have these 2 down the bottom, recent patients, which are patients that you've recently been into their ECRFs and edited, just in case you need to go back to someone quickly. And new patients is where you will see all of the patients registered via your site in order. So your earliest will be at the bottom, and it will go all the way through the top. Note here that I can see multiple different sites, for example, Rome and Queen Mary. You won't be able to see this as you will be limited to your site only. Now, the difference between these numbers, the x937 is the temporary ID assigned to a patient once they are first created. They will only then receive their full randomized ID once they have completed the screening and biopsy stages. So, in order to create a patient, first you go to this top button here, Create Patient. It will take you through to a very simple page where you will get the temp ID. This is automatically generated and starts from whatever letter has been assigned to your trial site. For example, X is assigned to Maryland Queen Mary University, so we'll stick with that. So it will start with X999, and then we'll go down X998, X997 accordingly. Here is an open entry data field where you can add in the initials of your patient. Please make sure that you space them out with a full stop. And here in the comments, anything that you feel is relevant or necessary, please leave a comment here. Once you've completed and you're happy with this, you can click Save. If, for any reason, the letter here is not the one that you are aware is assigned to your clinic, please do not hesitate to contact one of us at the main coordinating site. Once you've clicked Save, this will enter to the patient record page. There are a few things you must do before you can go forward. First of all, you will note the section here has been partially generated from the previous page. The temporary ID, the initials, and the comment. Also, your clinic name, shorthand, should be up here. If it doesn't match for any reason, then please let us know. And the study number will remain as unknown until the patient has been randomized. The data down here, don't worry about that just yet. That will be populated once we've completed the screening visit ECRF. Here, the yellow box is what you must complete to move forward. In order to then access the ECRFs, you must confirm that the patient has decided to proceed to screening. Once you've clicked that button, you can click Save, and these 3 buttons will be generated. Please note that once it has been selected and saved, you cannot change this. So the first visit will be screening. So if you click through to there, you will come through to the outline page. Here you will need to click the calendar button and enter the date of the visit. We'll go with that date. If, for whatever reason later on in a later visit, the patient does not attend, you can click the DNA, which stands for Did Not Attend button. Once you click that, that visit is locked and cannot be edited. Once you have entered in the date, you can click Next Page, which automatically saves the previous page and then moves you forward. Please note that there is also an alternative way of moving through the pages, which is through the index. Up the top here are how many different ECRF pages there are for this particular visit. So you click Index, it will bring them down this way, and you'll be able to see the name for each of these ECRFs. If you do wish to move forward a few pages at once, for example to procedures history, note that you will get this pop-up before you can do it. Do you want to save and leave this page? If you click OK, it will move you forward to the page that you selected. If you click Cancel, it will not move you. Over there. Okay, so in order to complete this, we will go through this one ECRF at a time to show you how all of the different functions in the database work. Study-specific consent date obtained, same as before, you click the calendar button and put in the date. We'll go with the day before of the visit. And next page. Again, the database has now saved that previous page. You can go back through previous page and you'll see that it's all saved. Please also note that at the top of ECRF, if there is anything specific that we wish you to know for that particular ECRF, it will be in red. So here, for example, note, consent must be obtained prior to any study-related investigations. Next, we wish you to confirm the inclusion and exclusion criteria. Here, you can click yes or no. If, please note, a patient is a screen failure following a screening visit, you must record the criteria that were not met down below. For the sake of this test, we will click yes and continue. Here, very similar again, you will need to select the calendar page and you can go back. As per protocol, the patients must be over the age of 18. Gender must also be recorded. Ethnicity can be recorded. This drop-down box must have an answer selected. However, if the patient does not wish to reveal their ethnicity, you can just go down to the bottom and click Not Stated, Patient Declined. Date of rheumatoid arthritis diagnosis, also through the calendar box. Here we have the RA classification criteria. You must select one answer within each of these 4 sections. What will then happen, they will then calculate a total. As you can see, it is now 8. If we change this, it will go down to 7. As per protocol, please note that the patient must have a value of 6 or higher in order to continue. Here, you can select yes or no, depending on the results. If you select yes to the last 3, you must specify in the text box. But for the sake of this, we will just click no and carry on. Here, we get to a little bit more complex section. The next few pages will look very similar to this. This one deals specifically with medical conditions that the patient may have. If a patient has no extra medical conditions, you can just tick this box here, and then as per the instruction, move on to the next section through the next page. This will then be blanked out. However, if you do want to add anything, you must go down to the button down here, Add New, which will take you through to a new page. You must state the medical condition here and the start date. This can be edited freehand. You must also state whether it is active or not, and then you can click Update. And then you will see that it appears here. If, for any reason, you wish to edit this, you just need to double-click this dark blue area, and it will come up with a pop-up, do you want to view or update this record? Okay. will take you back to the page. Once you've finished your update, click Update, and it will take you back. You can then move to the next page. As per the previous page, this is pretty similar. If there is no previous procedure history, you can just tick this box and move on. Otherwise, click Add New. Very similar, just type in the name of the procedure here in this box, the date of the procedure. Please see if you can get as much information as possible from the patient. If, however, they do not know one of the dates, such as the day or the month, you can just put 00 in, and then we know. If it is related to RA, please click yes or no as appropriate. And then again, it updates here, and then to edit, you just double click on the blue section. Allergies, again, is very similar. If you click Add New, this page does not have the related or active buttons. It is just the allergy and the start date of the allergy. However, for this section, just to show you what it looks like, we will click the No Allergies, and then you will note that the Add New button no longer works. Now we come on to the concomitant medication. You will notice that there are two separate sections here. Click Add New, and this is a little bit more in-depth. So here you would put the drug name, as well as the dosage. Please put this in units and time, the start date, and the condition being treated. Put something simple here such as pain, and update. As you can see, it is in the current medication section. Now, in order for a concomitant medication to move into the medication history, you will have to enter an end date. Here, you can see leave this date empty for current medication. However, if it is no longer current, they have finished this medication for whatever reason, you would update. And as you can see, it has moved away from the current medication section down to the medication history. This is triggered by entering an end date. For this page, anti-TNF therapy, please record all current medication. As you will note, there is no tick box to go on to the next section. As per protocol, they must have completed anti-TNF therapy, as you will see here. You'll enter the drug name, enter the dosage, again, units per over time. Here, you add in a start date and an end date. Please note that unlike the last section, an end date must be entered. And here, there are two reasons you can select from, either inadequate responder or reactions intolerance, and update. As you can see, it's pulled through. Next page. Again, very similar, DMARD therapy. As per protocol, please note that methotrexate does need to be noted here. Again, that is why there is no tick box to move on to the next section. So here, we shall put methotrexate, as well as the unit time. And we will add in a little bit more information here. And update, as you can see there. Again, as per the concomitant medication, once an end date is entered, it will move down into the medication history section. Corticosteroids. This section, again, has one of these tick boxes, unlike the previous two sections. I will show you what the Add New page looks like. Very similar to the previous ones. You add the drug name, the dosage, the start date, and the end date if applicable. We won't be adding one of those here though. You could just click the back button, and I'll click No Corticosteroid Therapy. Here is the clinical examination history section. Again, it has the tick box, but I will also show you what the Add New button looks like. Here is a drop-down box of the type: cardiovascular, respiratory, gastrointestinal, neurological, genitourinary, skin, rheumatological, or other. please select as appropriate. Then please detail any abnormal clinical findings here. If it is clinically relevant, please tick this. Otherwise, just leave it blank, as well as an end date if applicable. We will put clinically relevant and update. As you can see, it's all pulled through. Clinically relevant has come as a yes. If you do not tick that box, it will stay blank. Now we come into more manual data entry. Here, date of sampling, again, click the calendar button. We will put the same date as the visit. Now in these open data fields, please only enter numbers, do not enter any letters. So for the sake of this test, I will just be using the number 12. Here, a little bit more in depth. We enter in the results into all the relevant fields. Again, I'm just using 12 for the sake of this test. Please note that for each of these, we've put down the units of measurement. If you take these results and they are a different measurement, please convert as appropriate and enter the converted units into the database as per here to keep everything similar. The blood statuses need to be selected for each of the results. You'll have normal, abnormal, not clinically significant, and abnormal, clinically significant. You'll note that there's a little box down here which says, if selected abnormal, clinically significant, please record actions taken. If you select abnormal, clinically significant and do not complete anything in this box, it will flag up for attention on the dashboard, which I will show you later. For the case of this, we will just switch between normal and abnormal, not clinically significant. And again, at the bottom, date of sampling, I will put the same date as the visit. Again, we have more manual data entry. We will keep putting in 12. Also note that for these, we have a normal range stated here. If they go outside of the normal range, this may be raised as a data query, depending on how far out of the normal range it is. And again, same with immunoglobulins, we also have normal ranges. As stated in the routine blood page, please convert any results into these units of measurement if that is not the units of measurement you have used. Hepatitis serology. Now this is a very important page, and depending on your answers, the layout of the page will change slightly. So for the IGRA test, I will just pick T-spot. For the IGRA result, we click negative, nothing happens. However, if you click positive, this new section will pop up here. Please confirm patient has completed adequate antibiotic prophylaxis. As per protocol, in order to continue, the patient must have completed adequate antibiotic prophylaxis if they had a positive IGRA test. You click yes to continue, and then put in the data sampling. Again here, we have hepatitis B serology, hepatitis C serology, and HIV. You must note data sampling for each of these. Again, clicking the calendar button. And the result will go with negative for all of these. Note there's a little comment down here, according to local guidelines. Now we come to the vital signs where a few calculations will start to occur from this ECRF onwards. Enter the height, which please note must be in meters. So we'll enter in that. Weight. And it will automatically calculate the BMI of the patient. Blood pressure, pulse, and temperature. Again, they also have normal ranges stated here, so this may be raised as a data query later on if they are outside of these normal ranges. For the chest X-ray, you will enter the date performed and click the result. If there are any abnormal results found, please enter the name of them in each box separately. For here, we will just click normal and continue. The same is also for the ECG. You put in the date performed, click the result. If anything is abnormal, please put in the details here. Pregnancy test. If the patient is male, a box will appear down the bottom here, which will say not applicable, gender of patient is male. And these sections will be grayed out and you will not be able to enter any details. As this patient is noted as female gender, we must fill it in. If not applicable, click here, and as you'll see, this grays out and we cannot select any results, and you can move on appropriately. If it is applicable, please put the date performed and the result. Joint assessment. Here you must select the tender joints and down here the swollen joints. When I click which sections, you will see that they feed down into these boxes here. The total tender joint count and the tender and the swollen joint count here. If this is not feeding through for any reason, please do let us know. There are a few other sections you must complete on this page. Are any joints unable to be assessed? If you click yes, please specify which joints cannot be assessed. However, if you select no, you do not need to complete this data field. All joint assessments must be completed by a blinded joint assessor. This is just a way of confirming this. If the procedure has been completed by the blinded joint assessor, click yes and add in the initials. If it has not been completed by a blinded joint assessor, click no, and as per this note, please include an explanation on the summary page. Also, even if you click no, please enter the initials of the joint assessor. Please note that the joint assessor must be noted on the delegation log. Date performed, please click the calendar and select the date as appropriate. Here we come to the VAS pain score. This will have been completed on paper, partly by the patient, partly by the physician. And as you will see, mark a line on the scale below at the point that best describes your level of tiredness. Now to transcribe this from paper on to the database, this measures 100 millimeters, and the sliding scale is per millimeters. So please measure the VAS pain score on paper and transcribe it appropriately. As you move the sliding scale up or down, you will notice that the box here has a score which goes up and down as per the positioning of the slide. So we will stick to 68. Same again here. Same again here. And same again here. Please do not forget this little box here, early morning stiffness, duration in minutes. Sometimes, as it is quite small, it can be forgotten, but please enter a number. And again, date performed. Now these pages you do not edit, they are calculated from previous pages. As such, if for some reason some of these assessments have not been completed, this CDI score will not be calculated correctly. As you can see here, it's taken from the tender joint count, swollen joint count, patient FAS for global health, and the physician assessment. It is then calculated. The same is also done for the DAS-28, taken from the tender joint count, swollen joint count, ESR, and patient FAS for global health. The final page you will see for each ECRF is known as the summary page. This feeds through different information. As you go further through into the ECRS, there will be a lot more information noted here that you will be able to see. But for the first visits, current trial medication will stay as NA, as this is not assigned until randomization. CDI result, next patient assessment date. This also will not be generated until visit 3, known as the baseline visit. Cell type classification. This is a box that you will be unable to see. This is the cell type classification that comes from the biopsy samples. Here, this note box is what was referred to earlier in the joint assessment count. If you have any comments that you want to know or any explanations that you need to note down, please type them in here. One example, if an assessment is not completed for any reason, please note ND for not done in the relevant data field. All NDs must have an explanation noted on the summary page as to why that assessment was not completed. Also, most to all NDs will require a protocol deviation form to be submitted to the coordinating trials office. Once you have completed all of this, typed in all notes that you wish, click Save, as there is no next page button, and it has saved everything. You can go through and check all of your data through previous page or through the index as appropriate. Alternatively, if you are completely finished, you can click this button down here which says Dashboard. The dashboard will take you through to the current visits that this patient can have. As they have not yet been randomized, only visits 1 and visits 2 are available. Up the top is just a small summary of the patient with the study number unknown, temp system ID, and current medication, again NA. Here I will explain a few other sections. This one refers to the visit number, whereas this refers to the number of weeks. This visit date has been fed through from the outline page that you were in originally. Expected visit date will be NA for this point, but later on, as it is calculated 4 weeks from the previous visit, for further visits after visit 2, it will calculate the next expected visit date from the one prior. Please note, as per protocol, you do have a plus or minus 7-day window. The DA column is for disease activity, and it is a simple green traffic light system. Red, orange, and green. The orange stands for moderate disease activity, the red stands for high disease activity, and the green for low disease activity. It provides a very quick visual reference to the disease activity of that patient over time. The status column refers to the status of how much data has been added into that particular ECRF. Once you begin entering data, this will go to started, and the attention column will note all ECRFs with outstanding data fields that must be completed. Once you have gone through to the summary page and clicked Save, the status will show as completed. However, if there are still some ECRF pages which have data missing, they will still flag for attention here. This is a very good reference point, so once you have clicked Save on the summary page, it is always worthwhile coming back to the dashboard and checking the attention flags. If there are any attention flags, it will note that particular page, and you can go back into the visit and see what might be missing. In order to edit the page, you will see there is an action column here. You must first click the radio button, which will then make this drop-down menu available. And as you can see, there are different options. In order to edit, you must click the Edit option and not the View. And then you click Go, and it will take you through again. As you can see, I've moved on to visit 2. And again, we add the date and next page. Now straight away this changes, and I'll just go over a few brief points with you, as this is very similar to page ECRF 1. Here, there are no concomitant medication. If that is ticked, you can move straight on. However, here, as you can see, there was drug history added. But if there has been no change from the previous visit, you can just tick this, and again, the Add New button does not work, and you can move on. So here, there are a few pages that you will not be able to see as a center user permission. One of the pages I wish to take you to is Adverse Events. The Adverse Events ECRF will appear on every single visit from here on. If the patient has reported an adverse event at this visit, please click Yes. Otherwise, please click No. Do not leave this blank, as otherwise we will raise this as a data query just to confirm if any adverse events have or have not been reported. If you click No, you can just move on to the next page. However, by clicking Yes, the Add New button becomes available to click. Until you click the Yes button, the Add New button does not work. Here, the first question you are asked, is this a serious adverse event? If you click No, the page will stay the same and you just fill in all of these data fields as appropriate. If, however, you click Yes, as you will see, the page changes and becomes much longer. You must complete all of these sections and update. An SAE paper PCRF form must also be submitted to the Coordinating Trials Office. For now, we will just click No. We will go back and click No here. The adverse events and serious adverse events are split into two sections. The adverse events are all listed down in this bottom box, and any serious adverse events are listed in the top box. As per the previous fields, if you want to edit any serious or adverse events after they've been entered, you just need to double-click on the blue field. And again, I will take you through the summary page. Still no extra boxes. Once a patient has been randomized, all of the other visits will appear. But until then, you only stay with visits 1 and 2. As per my previous points, you can see that the status has now changed to started, as I have not gone onto the summary page and clicked Save Data. With the started, you can still see all of the attention flags. So these are all of the separate eCRF pages with a particular data field missing its relevant results. So from this, I would go through back into the visit, and I would go to each individual page and update as appropriate. Other elements that should be taught: adverse events. If an adverse event happens outside of a scheduled visit, you can click the Adverse Events button on the main dashboard page, and it brings you up into the Adverse Events section. As when you add an adverse event in a particular visit, the adverse event is linked to that time point. By clicking on the Adverse Event button in the dashboard, it is an unscheduled visit adverse event. Alternatively, there is the other button, Treatment Cessation. First, a pop-up will appear saying, "Are you sure?" and you can click OK and move through to this page. The exact rules for treatment cessation forms can be found in the protocol. However, just to show you what this is, has the patient had early treatment cessation? Yes. The related visit. Which visit does this apply to? Date of last infusion, again through the calendar button, and reason for stopping from trial treatment. Please select one of these options as appropriate. Is the patient able to participate in treatment cessation visit? Yes. Here you can see it says proceed to treatment cessation visit CRF. If you click no, it disappears. Is patient able to attend safety follow-up visits? Again, yes or no. And then you click save as appropriate. By going into the treatment cessation visit CRF, it will open up into, similarly, a visit eCRF with many different pages that you need to complete as normal for the assessments. The exact assessments needed for a treatment cessation visit can be found in the protocol assessment schedule. For this, we will not report any treatment cessation and go back to the dashboard. As I have not clicked save, the patient has not been shown as having treatment cessation. In order to go back to the main home page, you can either click the R4RA button up the top here or search patients, and it will take you back through to the main page. If you wish to visit a previous patient that you've already started data entry on, we can go, just click on the one you want and click go. And it will bring you through straight away to their patient record page. Now you can see what is slightly different here. Before a patient is randomized, you have two buttons up the top here, screening and biopsy, and it will take you through to the relevant visits. Once a patient is randomized, the study ID at the top here will populate with their randomized ID. And then down the bottom, instead of the screening and biopsy buttons, it's just the general patient dashboard. So we click that. It takes you through to the full patient dashboard with all 17 visits. And once they've also been randomized, you'll see at the top here, current medication as noted. And the study number has again been updated. I hope you found this useful. If you have any further questions regarding the R4RA database, please do not hesitate to contact one of us in the trials office. Our details can be found in the investigator site file in the main contact section, or alternatively in the R4RA database user manual, which should also have been provided with this training video.